So good morning. We're here today to talk about a new public awareness campaign urging people to keep doing their part to fight COVID-19 so we can all get back to doing the things we want to do. First, I want to give a daily update on COVID-19 cases. Yesterday, the Department of Public Health's daily report indicated that there were over 110,000 molecular tests reported. 2,721 cases were confirmed. The 7-day average for the positivity rate is just over 3%. 110,000 tests reported in a single day is obviously a huge number, and we continue to be a national leader in access to testing. Currently in Massachusetts, there are 893 confirmed COVID patients in the hospital. That's down from where it was at the end of last week, and 192 are in the ICU. We're also moving ahead to stand up a field hospital, which we talked about last week, to assist our healthcare system in Worcester, and that work is moving ahead as planned at the DCU. Before I talk about the public awareness campaign, I do want to reiterate some of the things we've said about Thanksgiving. I don't think it's any surprise or any secret to anyone who's been turning on the TV, reading the papers, listening to the radio, or paying attention to any of the commentary, observations, and news about COVID and Thanksgiving. Thanksgiving clearly represents a big potential risk for the spread of COVID-19, similar to the risk that it was in Canada back in October. It's no secret that we're in the middle of a second surge, and yes, there is clearly hope on the horizon with all the positive news about vaccines. But I think everybody in the public health space agrees that Thanksgiving and the holiday season generally need to be different than they've been in the past, and everybody has a role to play in helping us work our way through it. I just want to start by urging everyone to celebrate with members of your household and avoid any group get-togethers that you would normally do in a traditional year. If you do anything more than that, you really ought to wear a mask and keep it short, and hope that they wear a mask too. Be sure to observe the state's indoor gathering limit of 10 people. College students that are returning home need to get tested before they leave, and if they test positive, they need to quarantine. This is not just here in Massachusetts. This is a rule that's been adopted pretty much across the country by most states and by most colleges and universities. Don't share food or drink, and if necessary, open windows to allow for ventilation. And I'm going to repeat something that I've said many times before. Older people and those with pre-existing conditions, these are the people most at risk of serious illness or death from COVID. Please think about how your actions affect your elderly relatives or those friends or neighbors or relatives of yours who have pre-existing conditions. If you plan to spend time with these folks, please take the proper precautions. Wear a mask, distance, and keep your visit short. The bottom line here is to do everything you can to keep it small. I know that sounds harsh, and it runs counter to traditions and habits that we've all pursued around holiday season over the course of many, many years. But try to think about the fact that small can be intimate and just as special as larger gatherings. And larger gatherings are simply not worth the risk to you or your loved ones. The data on this one's pretty clear. Spending a lot of time indoors with many family and friends is exactly how the virus spreads. The biggest single driver of the spread in COVID-19 in Massachusetts these days is household spread. Big gatherings for long periods of time indoors during this holiday season, people being familiar and casual with people they're familiar with, is exactly the type of thing that will spread the virus. And we should all remember, and we said this before too, that there are many people who are in fact contagious and who can spread the virus, but whose symptoms will either be non-existent or relatively slight. They may think they just have allergies, they may think they have a cold, but in fact, they have COVID. And that's one of the reasons why we've been so aggressive about building out our testing capacity. and I think no one wants to be the person who's responsible for getting a family member sick. So please do what you can to avoid that risk altogether. And like I said, we are in the midst of a surge in cases. There is community transmission across the Commonwealth, and we are standing up at least one field hospital to treat a crush of ill patients. You can't afford to do Thanksgiving and the holidays the same way we've done it in years past. We'll certainly get through this. I think everybody agrees with that. There's hope on the horizon with respect to some very successful clinical trials around some powerful vaccines, including some that have been developed by researchers and scientists here in Massachusetts. But right now, protecting your family and your friends and your neighbors and your Commonwealth should be your primary thought with respect to this holiday season, and that depends on the actions of all of us as individuals. So please take that advice and avoid big groups. Wear a mask anytime you're outside your home or you're with people outside your immediate circle of friends and family. For more information, you can go to mass.gov/Thanksgiving 2020. To get back to the things we want to do and love to do, we need to keep doing the things that we know work. Wearing a face covering, avoiding big groups, keeping our distance, and getting tested. And today we're launching a new statewide public awareness campaign to urge people to keep it up and do just that. The campaign is called Get Back Mass, and it's a reminder that we must continue to fight so we can get back to the things we love to do. The campaign includes TV ads featuring real people's testimony from across the Commonwealth, talking about the things that they want to get back to. Spending time with friends and family, going to concerts, bringing kids to play dates. COVID has robbed us of those things and so many more. For months, we've been using a variety of channels to remind the public about the things we need to do to fight COVID-19. Through our COVID enforcement and intervention team, we've been delivering this message in a targeted way to individual communities, and we launched our #MaskUpMA campaign on social media this past summer. From buses to passed out flyers, cell phone alerts in print media in several languages, we've been chasing every outlet we can to get the right message in front of the right people. This campaign makes clear that we can, in fact, get back to the things we want to do if we wear face coverings, keep our distance, and get tested. It'll run on digital platforms in several languages and in TV ads that will run in English and Spanish. The digital ads and TV ads both launched yesterday and will run through February. We're also distributing Get Back Mask posters to stores across Massachusetts. In a minute, Secretary Sutters will talk a little more about the research driving this campaign and cover a few other announcements. But first, we want to give everybody a chance to take a look at the English and Spanish versions of the ads.
Thank you, Governor, Lieutenant Governor. Good morning, everyone. The Get Back Mask campaign is the result of a data-driven research to better understand public sentiments about COVID. Just over 1,000 people were surveyed to understand their attitudes around COVID-related behavior, barriers and motivators to engaging in precautionary behavior, reactions to specific motivators, messages, or videos, and differences among specific groups. Based upon the research, folks were attributed as COVID cautious or life is normal people. About 52% of the folks who were interviewed were COVID cautious, and 48% were life is normal. The motivator tests included self-oriented motivations, how to protect others, social pressure motivations, and doing what it takes to reduce risks. From the data, the most receptive messages from the overwhelming majority of people interviewed indicated concern for the health and safety of loved ones and the desire to put the safety of loved ones before their own. They want to enjoy time with their loved ones and return to experiences they enjoy together, from traveling to birthday parties to hugs, some of which you saw on the videos. We also know that the best protection is the basic public health measures: wearing a face covering, physical distancing, staying home if ill, and washing hands frequently. As one Commonwealth, we have worked hard over the past 10 months to stop the spread, but the data is clear. We need to remain vigilant, each and every one of us, for our loved ones. The campaign draws a clear connection to what we all long for, to return to, and the essential steps we must keep taking every day to get back mass. As the governor said, it's a multilingual campaign. You saw the Spanish and English TV spots just now. They're animated videos in Spanish, Portuguese, Haitian Creole, Chinese, both simplified and traditional, Vietnamese, and English are running on digital and social platforms where people spend time. There will be signs, as the governor said, across the Commonwealth and the DOT billboards. As we lean into the holidays this week and going forward, let us be reminded that short-term sacrifices like staying home, avoiding gatherings, large gatherings, practicing good hygiene, and of course wearing a mask will go a long way to helping us get back mass. Changing gears a bit. Last week, the governor with Commissioner Riley announced the Abbott Binax Now testing program for K-12 schools. Today, we're announcing the extension of the Abbott Binax Now testing program to include Massachusetts long-term care facilities as an extra level of precaution in response to community transmission. Abbott Binax Now test kits can be used in long-term care facilities for the purpose of testing individuals entering the facility who are not regularly reporting staff, such as visitors, nursing home surveyors, and the like. Those who test positive should be treated as a positive COVID case, be declined entry to the long-term care facility, and encouraged to contact their health care provider. Those who test negative may be allowed to enter the facility, provided that they meet the other screening criteria we have in place. They're not exhibiting any COVID-19-like symptoms, and comply with other in-person visitation requirements, such as wearing masks and distancing. Binax Now tests should not be used for broad-scale asymptomatic testing of staff and residents. We know this time of year can be difficult for many, and particularly in long-term care facilities, and it's important to preserve the quality of life of loved ones in those facilities. The use of Abbott Binax Now testing will continue to allow quality of life to be paramount while also preserving the health and well-being of residents, staff, and visitors. Also, I just want to remind folks that the Abbott Binax Now validation study report is available online at mass.gov/COVID-19 testing. In addition, today, the Commonwealth is updating its surveillance testing guidance for long-term care facilities. Due to increased community transmission, nursing homes and rest homes across the state will perform weekly surveillance testing of all staff, rather than what had been in every other week a testing requirement. In addition to the weekly surveillance testing, facilities should continue to test all close contact residents and staff if there's a new case in the facility. The state continues to support surveillance testing costs for all of these long-term care facilities. Additionally, on community-based funding, grant funding, today we announced the award of $650,000 in grant funds to community-based and faith-based organizations to help reduce the spread and increase awareness about COVID-19 among communities of color in the cities and towns hardest hit by COVID. Data over the course of the pandemic has shown that communities of color experience, in addition to institutional racism, disproportionate infection and death rates. The COVID-19 Community Grant Program supports nonprofit, community-based, and faith-based organizations, as I said, to raise awareness. 20 organizations are receiving grants, and each of them demonstrated deep engagement with their communities and understanding the needs and a readiness to quickly implement the proposed projects. And finally, one housekeeping note. This week, the COVID-19 dashboard reports will not be published on Thanksgiving, Thursday, November 26. We will publish the daily reports and the weekly COVID report on Friday, November 27th, and obviously for the 2 days of Thursday and Friday. Thank you. I hope all of you have a safe and healthy Thanksgiving. Governor?
Questions?
Governor, it's hard to know how many people are staying home, but we look at the TSA stats, and they said 4.5 million people traveled over the weekend last year. This year, 2 million, just under half. Of course, that's not just Logan, that's the whole country. How frustrating is it to you that maybe not everybody is listening to this message, even with a shiny new campaign?
Well, first of all, I would just start by saying that the fact that travel data coming from the TSA is down nationally implies that the message that's been delivered by folks like us and by many others across the country has clearly resonated with many people. I would hope the other thing that comes out of this from those who do choose to travel is an awareness and appreciation for why it's important to take the proper precautions if you are going to travel and spend a lot of time with people you don't normally spend time with. To recognize and understand that you should wear a face covering, they should wear a face covering, people should distance, that the rules that are associated with dealing with people, even if they're people you know and have a long history with, if you haven't been spending time with them, you need to incorporate that into the way you behave. I had a conversation with somebody last week who said to me that it's very hard for people to believe that their friend, their neighbor, their teammate, in some cases even their family member, would be somebody who wasn't being quote unquote as cautious as they were about how they dealt with all of these issues. And they get the fact that you have to assume, if you're not spending time with somebody on a regular basis, that they are in fact potentially somebody who could infect you or you could infect. And that's why it's important for people to take the proper precautions. My hope is that the folks that do travel recognize and understand that they have an additional responsibility here with respect to how they deal with people they're coming in contact with who they don't normally spend time with.
And what's Thanksgiving going to look like at the Baker household? Do you have a family coming in?
We have immediate family.
Governor, are you concerned?
I'll try and visit my dad at some point. My brothers are off doing their own thing.
What concerns do you have for 2 weeks from now? Obviously, you said it, we're in a surge, cases are climbing, but in 2 weeks, what's the plan? Assuming that a lot of people are traveling after Thanksgiving and that cases could sort of climb.
Well, we obviously aren't going to be able to predict exactly how people treat this holiday or what we'll be dealing with 2 weeks from now. I don't think, I can't speak for others on the team, but I did not expect or anticipate that we would go north of 100,000 tests on average for 3 or 4 days in a row here, primarily because people were being tested based at least on the interviews that many of the people in this room did with folks that were related to travel. I think the thing we'll do is continue to look at the data. As I said in my remarks, we actually saw over the course of the weekend anyway, which is unusual, a dip in the number of people who were hospitalized for COVID. And we continue to talk on a very regular basis with our colleagues in both the long-term care community and in the hospital community about what they're seeing and what they're learning and how we should be working to help and support them in their efforts. And that, in many respects, is going to drive a lot of our decisions.
Right now, do you think you should open up more testing sites
Yeah, I mean, one of the things I would say is that we have 250 testing sites in Massachusetts. It's not just the 17 Stop the Spread sites. There are 250 sites in Massachusetts where you can get tested. And anybody who has insurance can get tested in Massachusetts under a standing order that was issued by the Department of Public Health, for the most part, without any out-of-pocket expense at all. And I do know that the actual activity in many of those other testing locations goes up and goes down depending upon what's going on in particular communities at a particular time. We're going to do what we can to continue to expand our testing infrastructure, but I think one of the things we're wondering about here is whether or not, in fact, that colossal increase we've seen over the past few days, which does appear to be related in some ways to the holidays, is going to continue or actually start to move down. And we won't know that till we get a few more days worth of data.
Governor, right now,
Are the protocols secure enough for people to take advantage of the Good Friday, the day after Thanksgiving? Do you any special messaging there from the state?
Well, I think the first thing I'd say about, you're talking now about the shopping day on Friday? Well, the retailers in Massachusetts are certainly looking forward to that because I think many of them feel that they've had an enormously difficult period from the beginning of the pandemic. I guess what I would say, and I think I would echo what the Lieutenant Governor would say as well, is if you're going to shop and you think you need to shop online, you can certainly shop online and do that with local organizations and local retailers. There are very few retailers left at this point in time who don't have an online capability. If you do go to the store to go shopping, you should obviously pay attention to the protocols because I'm sure the stores will be paying attention to them as well, and recognize and understand that a huge part of the local economy here in Massachusetts is driven by consumer spending. And I guess I would just urge people, even if you use a national platform or a global platform to do your searching for certain things you want to buy, it would be terrific if you could choose, if you're on those platforms, to buy from Massachusetts-based companies if you're not going to go out. If you are going to go out, you should follow our protocols, and hopefully, and I anticipate that the businesses that you'll go out and visit will certainly follow them as well.
Governor, right now,
Follow up on the question about testing. If the number of people who are seeking tests continues to go up after Thanksgiving is over, like through the end of the year, is there a plan to perhaps increase the lab capacity or anything like that to speed along and get down the line if you're not going to open additional sites?
We do have conversations that are currently going on with a number of providers about expanding lab capacity, and I think we can anticipate that sometime around the middle of December there will be additional capacity that comes online.
And if that does occur, to help it go down, but if not, is there a plan to ration the test perhaps, like we saw back in the spring?
I think our goal is going to try to be to make sure we have enough testing capacity to serve the people who are out there. I do believe some of the things we're doing will give us the ability to expand capacity. We've said from the beginning that we want to make sure people get tested. You know, one other thing that could happen with respect to this testing question, there are billions of dollars in appropriated but unallocated federal funds. And this is a perfect example of why, you know, the current sort of stalemate in Washington, both legislatively and administratively, is such a problem for people who are trying to wrestle through this pandemic. You would think that even in a state like ours, which has as much access to testing per capita as you're going to find anywhere in the country, is struggling to deliver on the demands and expectations of an appropriately concerned public. This would be a great time for the feds to move forward and release many of those funds that they have so that people would be able to incorporate that into expanding their testing capacity. And I would like to see that along with a bunch of other things happen. Just because it's a lame duck session and just because there's a transition coming here doesn't mean people aren't still dealing in a real world with all the issues associated with COVID every day.
Governor, speaking of the feds and the transition, you took part with other governors last week in a conference call with President-elect Biden as far as the pandemic.
Vice President-elect Kamala Harris was on that call too.
How are you feeling about the incoming administration? Are you encouraged that things may get better after January 20th?
I would start by saying that I don't think we should be waiting until January 20th. There's a continuing resolution that has to be passed by Congress between now and the end of this calendar year. They also need to reauthorize some of the unemployment insurance funding that they put out as part of the CARES Act. I know I speak for most governors when I say if you're going to be in the business of making decisions and appropriating funding that is involving both the continuing resolution and the unemployment program, that would be a perfectly appropriate time for the Senate and for Congress to at least enact all the stuff that they've already agreed on, a lot of which has to do with education funding at the K through 12 and higher ed level, more money for testing, and a variety of other pieces like that, which were never really a source of significant, it didn't appear anyway, significant disagreement between the parties or the branches. I don't see why we have to wait till January 20th for any of that to happen. I would also say that some of the work associated with moving forward on the vaccine, which we have a team that's in place in Massachusetts that's in continual conversation with the feds, that is not something that should wait until the transition either. That's the sort of thing where I would hope we would continue to see progress on a go-forward basis from this point on with respect to the final reviews of the clinical trials, the addition of additional folks who are finishing their trials. There are many other trials besides the Pfizer trial and the Moderna trial that are going on. J&J has a big trial going on. AstraZeneca has a big trial going on. I mean, there's a lot of work that could be done every single day associated with the fight against the pandemic that needs to continue. And as I've said before, I think the transition team of the Biden Harris incoming administration should have access to and be engaged with on a regular basis the White House task force that's been running this thing in D.C. for the past 10 months. And the inability of these folks at the federal level to get past the election and into the actual act of cooperating and collaborating and continue to move forward and make decisions is an enormous imposition and potentially a seriously negative, with seriously negative consequences on the people of this country.
Do you think President Trump cares?
I think it's really important for the president and his team to focus on what's directly in front of everybody in this country, which is how are we going to continue to fight and battle this pandemic. That should be priority number one. Priority number two should be making that transition work, because that's an important part of that as well. I mean, I said before that I believe that we had an election in which 145 million people voted, the biggest number ever in U.S. history. And as different states continue to certify the results, especially in some of the states that were contested, I think people need to move on. And I've said that before.
Governor, right now the forecast is calling for rain on Thursday for Thanksgiving. A lot of people were planning on outdoor. Are you concerned people are going to move indoors? And what kind of enforcement would you like to see if people violate these indoor gathering limits on Thanksgiving Day?
We've spent a lot of time talking to our colleagues in local government about all the issues around enforcement, and I think most of them are pursuing what I would describe as an appropriate approach to enforcement, which is to try to basically encourage people, if they're part of a big indoor group, to simply go home rather than get in the business of fining people. But every community's got to handle that in the way they think makes the most sense.
Governor, we're still hearing from folks who are having problems because of the unemployment fraud claims and all of that. Their benefits are still being held up. This is obviously still going on. Do you think the state should assign more people to this issue, and can you provide us with any updated numbers?
So my own view is, and I'd say this right to the camera, if somebody's having trouble with the unemployment insurance system and they have a credible claim, they should be reaching out. If they're reaching out to the UI office, they should also be reaching out to constituent services and leaving a message on our voicemail, and we'll follow up on it from there as well. Last week, there were 31,000 unemployment claims filed in Massachusetts, 1,000 of which actually passed the screening. There's a tremendous amount of sort of bot-based fraud going on around UI. And it is creating issues with respect to how many new claims, and this is true across the country, and it's creating three problems. The first is it's very hard to get an accurate count with all of this bot-based activity going on about how many new claims are actually being filed each week. That's problem number one. Problem number two is UI departments, under a whole bunch of important and appropriate federal regulations, have to make sure that they are not paying money out to people who either don't exist or don't qualify or aren't out of work, all right? Which has been a problem since this whole thing began last spring. And the third thing is it creates a time link that's an issue for people who are appropriately, legally entitled to those benefits with respect to when they actually move the system forward on their behalf. So if people are having issues, they should, and they're not getting whatever kind of answer they want out of the UI program, they should be reaching out to our constituent service office as well. The final thing I'll say on this is some of these fraudsters are actually paying people to call unemployment offices around the country and advocate for benefits, pretending to be somebody they're not, who's not in fact actually unemployed.
What do you say to people, the holidays are here and things are being held up because of
Call. We'll get on it. We will.
Governor, with the grant program, could you elaborate on what the grant program's parameters are, how you expect faith-based or community-based organizations?
Yeah, I'll let Mary Lou speak to this one.
And also, I don't know if it's COVID money or where the money's coming from.
Yeah.
So the money comes from, so as you know, in the Department of Public Health, when we, I'm sorry. I'm so used to wearing these, I sort of forget, which I guess is a good thing, except I'm mumbling into the microphone. As you know, when the Department of Public Health does large DON projects, there's money that comes back for community benefits. There's money that comes back for community benefits. So it's the funds that come from these large DON projects that then comes into the Department of Public Health to determine community benefits. And so that's where the funds come from. It sits in a reserve account. And so we felt that the focus was a health equity lens and COVID. And so as part of the community enforcement and intervention teams on the weekly calls with all those communities, we said we had a grant application going out and really wanted faith-based organizations and community organizations who are deeply embedded in their communities that may not trust government, may not trust other sources for information. So it was a very simple application process. And I'll just give you a couple of examples, for example. So of course, I don't have my glasses on, so you'll have to bear with me. So in Revere, it's the Association of Islamic Charitable Projects. And it's really around how to connect with their community around COVID, myth busting, how to help people get tested if they need it, whatever it is in their community that they need. So we really tried to go to like New North Citizens Council in Springfield, Somali Parents Advocacy Center, Education in Everett, the Boston Project Ministries, Who's Got Morale in Boston, the Worcester Interfaith in Worcester. So these are very much grassroots local organizations, and attached to the press release today is a list of all of the grant applications. So we feel, again, we're trying to reach, as the governor would say, these messages to all communities, and there's different ways that communities connect. And we know what the disparate impact has been of COVID on specific communities. So we worked directly with local municipalities to get the word out, made it the simple form for applications, and pumped the money out. I think it's like Monday.
So I know the department probably had to review several applications, but are there any that stood out to you? Generally, any idea of what would be a good way to use that money, or a good way to convince some of those to follow protocols or be more trusting?
So, I think one of the things you realize in government sometimes is to get messages out is to not be terribly prescriptive, right? What might be, from my perspective, the right way to communicate with a community is different than if you connect to a community organization who's very embedded with their community, whether it's ethnic or language, and have them take what we want, which is how to help people understand what COVID is, the risks of COVID, and then trust them to communicate that message. I think that is a very strong way for government to connect as broad as possible, rather than traditional contracting mechanisms.
Last question. I have a question about the vaccine. If we're potentially weeks away from distribution, where does this stand with that? Are you ready to roll this out, and do you have everything you need to get a vaccine?
So with respect to the vaccine and the rollout, the first thing I would remind people is we do currently process and distribute millions of vaccines in Massachusetts every year. Obviously, the most familiar one for people is the flu vaccine, but there are others as well. And there's an existing infrastructure that's already in place that, generally speaking, understands most of the elements associated with the distribution and inoculation process that's associated with vaccines. The big issue associated with this one is the role of the states and the role of the feds in ensuring that they finish all the work associated with the clinical trial results, that they then develop what I would refer to as the manufacturing protocols, and that they then go ahead and begin to manufacture, and at that point start distribution, with the idea that the distribution is going to be targeted to particular high-risk elements of the states and the country first. And that is something that there's a task force that is set up through the command center that is communicating directly with the federal government around what we here in Massachusetts need to do to actually follow through and deliver on that. I don't want to put numbers out there yet because those are still being discussed, but I think the idea is to have a fairly significant amount of vaccines start to be available sometime early in 2021, with that amount growing sort of over the course of the first 5 or 6 months of the calendar year.
And when will the protocols dial back based on the results of that? Is it like a certain percentage of the population? Have you even thought about that yet?
Well, the way the big conversation that's been going on is, healthcare workers, long-term care workers, people with pre-existing communities, folks in communities that have been adversely affected. I mean, there's a lot of discussion about where the original focus of vaccine distribution should be. But I would say that hasn't been fully decided yet. Yeah.
With the vaccine rollout still a month or two away at the earliest, and still well into the new year, are you afraid that this pandemic's going to get worse before it gets better?
Well, I think certainly if you look at the growth in cases across the world and around the country and here in Massachusetts, there's been significant case growth week over week now for quite a period of time. I think the things we pay the most attention to are how are we doing with respect to hospital capacity generally, and I think our current occupancy rate of sort of staff capacity is around 67, 66%. So there are a lot of beds available that are staffed in Massachusetts on the hospital side currently. and we're probably at around 50% on ICU? 48, okay. So those are the things we pay the most attention to there. The other thing I would just say is getting back to the question about testing, and I've said this before, in the spring, we didn't do a heck of a lot of testing because we didn't have a lot of testing infrastructure, and so there were a lot of cases that never got tested, and there have been studies done that suggest that in the spring we probably found 1 of every 15 or 20 cases. People think based on the amount of testing we're doing now that we probably find about 1 in every 4 cases. Now the good news there is every time you find a case, you can help that person isolate, and they now know they're positive, and they will not therefore go about, hopefully, sharing this with other people until they actually isolate for the time period that's required for the virus to run its course if they don't actually get sick enough to end up requiring hospitalization or use of the healthcare system. And I think that's, in some respects, why the amount of testing we do is so important.
Thanks, everyone.
Jeffrey?
You said last week, I didn't get to hear it myself, but you said something about rethinking transportation climate. Would you be a little more specific? Are you backing away from it, or are you just tinkering around the edge?
No, the important thing around that is I talked about modeling. One of the things that was based on a certain set of, the TCI was based on a certain set of assumptions about volume, right, and congestion. And it may be that at some point, I don't know when that would be, down the road, we'll be back to where we were with respect to that. But I think at this point in time, it's important to sort of re-examine a lot of the assumptions that went into what the impact would be in terms of carbon reduction based on the changing nature of transportation generally. And I think that is an important element, not just for us, but for the other states that are participating in this conversation. If you pursue a price on carbon associated with transportation, what do you get for that price on carbon in a world that looks a lot different now and potentially will stay a lot different for the next several years relative to the one we thought we were living in a year ago?
Governor,
Does that mean you're going to postpone the decision? The decision is going to be this fall?
Yeah, we're still, no, our goal and our assumption is that by the end of the year, people will make a decision.
Governor Cambridge is considering ending indoor dining. They're going to discuss it at a meeting this afternoon. Just curious what you think about that, and is that something the state would consider?
Yeah, we've said many times that what we're trying to do with our rules and our guidance is establish what I would describe as a statewide framework. But we don't allow, once we put that statewide framework in place, for communities to operate at a level that is more permissive than whatever we've put in place, right? If we have a mask order in place, we expect that mask order to apply everywhere, okay? If we have rules in place with respect to the operation of retail businesses, we expect those rules for retail businesses to be the same across the Commonwealth. But we've also said that local communities, if they believe their community needs to go beyond what we've done, that we support their ability to do that. And I can come up, Somerville made decisions back in the spring about reopening that were slower than the decisions we made with respect to our reopening deadlines. Certain communities made decisions about construction that were different than ours, and they wanted to go on a slower, either a more narrow path or a slower path with respect to construction. Pittsfield, we talked about this last week, Pittsfield made a decision to postpone, suspend indoor dining based on an outbreak that they saw out there. This is all consistent with what we would describe as giving locals the flexibility, if they think there's something in their community they need to deal with, to go ahead and do that. But our goal is to establish what we would consider to be a statewide framework that people operate basically within. And I don't want to get into the business, especially if you're a retailer and you have 20 sites in Massachusetts, I would like you to be able to play with the same set of rules in all 20 sites. I think it gets really complicated for them if they have to operate on a different set of rules in every community. But communities do have the ability to make decisions on their own if they think there are particular things they want to address.
But the data statewide doesn't say we should do that.
Say again?
The data statewide for indoor dining doesn't say we should do that. In Cambridge it might, or Pittsfield it might, but statewide you don't think it says indoor dining.
No, we haven't seen anything that would imply otherwise on that at this time. And
Thank you.
we'll see you all tomorrow.